And welcome to The Conversation, a program that interrogates some of those topical issues affecting our country. My name is Nyasha Pambuka, and today we have Dr. Benson Dandira, the president of the Progressive Doctors Association of Zimbabwe, and the association spokesperson, Dr. Anesu Rangwane. Welcome to the program.
Thank you so much, Ruby.
Now, can you begin by telling us more about this organization, this association, Progressive Doctors Association of Zimbabwe? I'll start with you, Dr. Dandira.
Okay, thank you so much. So the Progressive Doctors Association of Zimbabwe was initially, we initially came up with it as an idea through at that point, the ongoing incapacitation or industrial action by doctors nationwide. To say we are incapacitated, yes, but it's our fellow countrymen that are dying. They are not only patients, they are our brothers, sisters, mothers, and fathers. So that's when we came up and said, yes, we need our concerns as doctors to be addressed, but it's also the nation of Zimbabwe that has to be put first in terms of they cannot continue to suffer when we continue to have an impasse with the government.
And now coming to you, Dr. Rangwan, what is the main mission of your association?
Okay, for now, we can safely say in the short term, the biggest reason why we came up with the association, we are going to try and come up with a solution to the ongoing crisis that is facing the nation's healthcare delivery system. It's been over 100 days now since doctors are down their tools over issues of inadequate remuneration and deplorable conditions in the nation's public hospitals. And to this date, a solution has not yet been found. People keep dying, preventable deaths in our hospitals, whilst the government and doctors who were being led by the ZSDA then engaged in a tug of war. So we're coming in, we're the new association now on the scene, Progressive Doctors Association of Zimbabwe. We hope we can be able to be the go-between between our colleagues and the government and come up with a solution to end the current impasse.
And now, Dr. Dandira, I understand that the Progressive Doctors Association of Zimbabwe was launched last Saturday. How many doctors are now affiliated to the organization so far?
Okay, thank you so much. As you've just said, our launch was on the 14th of December, which was last Saturday, and we are pleased to inform everyone that we are a registered association with the Health Services Board. In terms of membership, at the moment, we are still compiling and coming up with members that are registered throughout the hospitals in the country. So if you are looking for an absolute figure, I cannot provide at the moment because we are still coming up with the database. But all I can say is our indications are quite promising. Our message throughout has been, doctors, can we go back to work so that we can engage with our employer? And we are pleased to announce that most of the doctors, especially the junior doctors, are now back at work.
And Dr. Rangwane, you were originally members of the Zimbabwe Hospital Doctors Association of Zimbabwe. Why did you leave the organization and how different are you from them?
Okay, so the ZSDA is the association that we've always known ever since we went into medical school and even when we initially entered into the profession. So we do not want to be viewed as a breakaway group as such, but I think it is progressive, as our name says. Whenever you have a difference in opinion, you know. As Peters, we are saying, yes, we were members, but we do not agree with the methods or the approach of our sister association in the way they have handled this crisis so far. Like I said, they led us into the incapacitation. Now we are over 100 days. Still, a solution is not in sight, and at what cost? At the massive cost of human life. Life once lost, you cannot get it back again. So as P does, how we're different, we're saying we do share the same grievances with ZSTA. After all, we are united by the fact that we're all doctors first. before you are ZSDA, before you are PDAS. But we are choosing to approach this crisis from a different angle. We are saying, so until we find a solution, what happens to our people? We cannot derive any satisfaction from marking 100 days, 200 days, 300 days whilst we're at home and our people are dying. We're saying, let's keep engaging the employer, right? But let's do that whilst we're what? Whilst we're at work, and we put our patients first and understand their plight, because the people who suffer the most are the ordinary Zimbabweans who cannot afford to go into private for treatment. They have to come to the public hospitals where we work, where we haven't been for over these 100 days. That's the major difference between our two associations.
And now coming to you, Dr. Dandira. There have been reports that the Zimbabwe Hospital Doctors Association is being funded by a third force bent on destroying the health sector. What is your comment on that?
Okay. Yes, there have been reports on social media and various platforms to say maybe they are funded. But I would like to say we were once members of the Zimbabwe Hospital Doctors Association, and I think when it comes to that, it's our leadership, or the current leadership of Zimbabwe Doctors Association, which should come out and say, are those allegations true or they are not? If there are issues to do with finance and how they got funding for other things, they should just come out in the open to say, these were our funders for this, these were our funders for this, so that they clear these allegations that are there. So I cannot safely comment on whether that allegation is true or not.
But you used to be members of this organization. Are you sure you're not aware who were funding them or what?
We really have no idea, and it's really difficult to speak on allegations. Well, people talk. That's what people do. So we were ordinary members of the ZSDA just by virtue of being in the profession. It was the only association that was there. So like what my president is saying, I think it now becomes the responsibility of the ZSDA leadership to come out in the open and clear the air, because well, those allegations are there and people are talking, and to date they keep encouraging their members to stay at home. So when they start getting such accusations, I believe it is upon them to come out and clear their names.
You said in the beginning that your association is there to settle the impasse that has been there in the health sector. What is the current situation in our hospitals so far? At Harare Hospital, at Salim Mugabe, formerly Harare Hospital, Parenyato Hospital, and Chitumbiza Hospital. What is the situation?
Okay, thank you so much. So we are pleased to say the situation is improved slightly from where we were before we launched and before this idea came in. So currently most of our doctors are down tools, especially the junior doctors as well as middle level and senior level doctors. But for Parenyato, most of the junior doctors are now back at work. There are senior doctors there who are still who have been there throughout the industrial action by all doctors, but the middle level doctors, most of them are not yet at work. So it is our call to say about 60 to 70% of the junior doctors that have come back at Parenyato, we still need more to come back so that the situation can be restored to normalcy. Harare Hospital, they are almost the same figures. About 60 to 70% as well of the junior doctors have reported back to work, with some middle-level doctors as well as seniors. For Chitumbiza, we are almost at 90 to 100% functioning in terms of capacity. So our situation is slightly improved, but we are simply putting this call to everyone who is middle-level, senior level, or junior doctors to say, let's go back to work and let's try to save our patients.
Since then, you've also mentioned that not all doctors have come back to work as yet. And now that we are in the festive season, we're bound to have so many road accidents. What measures are you going to take to make sure that we have enough doctors in our hospitals to save lives?
So on our part, we will keep pushing and preaching our message like we've been doing. We are pleased to say a lot of doctors have responded to our call and have willingly gone back to work and signed resumption of duty forms. I guess it is in the same vein that I have to acknowledge other players who have come in to help in try finding a solution to this situation. I would like to give a special mention to the High Life Foundation. They came in, they gave an offer to try and provide an incentive to our salaries, and it has helped because we saw a positive response from a lot of doctors coming back to work, especially with a view to beef up the human resources takatarisana ne-festive season iyoyi. So we are also urging other members, other development partners, members of the corporate world. This is no longer a doctor's problem. It's no longer the government's problem alone. This is a problem, a crisis that's facing the entire nation. So we really need all the help we can get. So as an association, we are extending this call to other members of the corporate world to follow in the example that was set by High Life Foundation to come chip in any way they can, and possibly we can have our hospitals functional in this festive season.
Dr. Dandira, Dr. Rangwan here is mentioning that most doctors are willing to come back to work. And now, how do you balance that in terms of the welfare of the doctors? Have their challenges been addressed by government? What do you have to say about it?
I would love to say, yes, the doctors' welfare still remains a key priority of our association. If as an association, we are mainly looking at three things. Number one, which is our patients, which is the general public of Zimbabwe. Number two, which is the doctors' welfare, which needs to be addressed. Number three, anyone who is willing to work with us in achieving the national interest for health. So when it comes to the issue that you have mentioned, particularly to do with doctors' welfare, yes, it is true that the concerns have not been adequately addressed. The government, yes, has offered certain offers which were rejected by the Zimbabwe Doctors Association. True to say, they are inadequate at the moment. But all we are saying is, as an association with our three pillars, let's try to find a common ground where we can have a doctor maybe remunerated reasonably and with a living wage, while they provide the service, while government also does its part. So in terms of the welfare of doctors, currently it has not been addressed, but we are happy to say engagements with our employer so far, they have been quite positive in saying your concerns are quite genuine, and it is the government's responsibility, and the government is working tirelessly to come up with an offer that the doctors will be willing to take. So it's being addressed.
So can you say government has shown enough political will so far?
Well, I wouldn't like to speak for anyone other than ourselves, but like what the president is saying, from the interaction that we've had so far with them, we feel encouraged and we are hopeful that sooner rather than later we'll be able to find common ground, come up with a living wage for our doctors, and also with the help coming in from other players, perhaps we can find a solution.
Well, we've now come to the end of our program. Doctors, thank you so much for coming to the show.